My name is Liz Fonga, a registered nurse working in a thought disorder crisis stabilization unit with Shepherd Pratt Hospital, a DMP student at UMass Global University. Within my role as a psych registered nurse, I work with patients across the lifespan, floating to the co-occurring drug users unit, young adult unit, adult and adolescent unit. Today, I'll be presenting a video on my stakeholder education plan for my scholarly project on curbing recurrent cannabis use. My clinical scholarly project looks at young adults aged 18 to 22 years old with recurrent cannabis use disorder. My project in the PCOT format reads, does the use of the SBAT assessment tool by nurses on admission to the psych unit increases early recognition and referral for treatment and follow-up compared with the absence of non-assessment over a 12-week period. This project is a quality improvement program with a goal to identify and treat young adults with recurring cannabis use. A brief background and significance of my project. Substance misuse is a critical social and healthcare issue, and learning how to effectively screen for misuse and perform a brief intervention is useful for all healthcare professionals. Approximately 1 out of every 7 hospitalized patients have a substance use disorder in the United States. Its recurrent use comes with potential cognitive impairment, poor academic performance, increased rate of addiction, mood, and psychotic disorders. Most importantly, cannabis remains one of the most accessed and abused substances among young adults. Due to the serious consequences associated with substance use, nurses should assess for misuse of cannabis by patients on admission and intervene when appropriate. Nurses can be aided in this process by using the screening, brief intervention, and referral to treatment, the SBAT tool. Nurses make the largest sector of the healthcare professional in the hospitals and are well positioned to use the SBAT screening tool. Research indicates that the healthcare providers do not consistently use a validated tool to screen for substance misuse, and the majority of patients who use substances do not receive optimal treatment. As such, to reduce costs, maximize resources, thereby saving taxpayers' money, SBAT should be implemented and used by nurses as part of their admission process. Now, the stakeholders involved in this project are the nurses, the physicians, advanced practice registered nurses, the patients themselves, family members, information technology team, the therapists, the quality improvement team as well. Each stakeholder has a role in recurrent cannabis use. The nurses will use the SBAT tool to screen the patient, assess and document the use of drugs by the patient, communicates findings with the multidisciplinary team for interventions. The physicians will review patients' charts and place orders for individual intervention for treatment. The unit manager will provide resources to enable nurses implement the assessment of cannabis misuse with the use of the SBAT tool and monitor compliance. The quality improvement team will utilize the quality improvement instruments to enhance the use of the SBAT tool. Family members will assist nurses and physicians with collateral. The therapists are responsible for assessing patients and carry out activities to enhance drug avoidance. The nurse educators will provide evidence-based training to both old and new employees to enhance the use of the tool. The information technologies on their part will provide innovation to facilitate the use of the SBAT tool on the computer during assessment. Now, the conceptual and theoretical framework that has been carefully identified and selected to guide this project is a Kurt Lewin social field theory. Lewin's social field theory will provide a framework to conceptualize, plan, and implement the change. This model was carefully selected because it allowed for building a new social organization by the participants. Organizational change is difficult in most large settings. Work patterns become institutionalized and personnel resist change. Lewin was the first to develop the notion that change should be planned rather than allow unintentional or accidental processes to occur. And he first described the 3 levels of change as unfreezing, changing, and rephrasing. Using this theory for my project, I will demonstrate the need to change and explain why maintaining the status quo would be detrimental to patients, employees, the organization, and the community. Applying the unfreezing stage of Lewin's theory, physicians and staff will be motivated to change by unraveling the outcome of the non-use of SBAT tool on admission and creating a sense of urgency around the shared vision of how patient care outcomes and the work environment could be enhanced by the proposed change. The change stage will include staff training of the right use of the SBAT tool to improve current practice. And the rephrasing phase will include implementation of the use of the SBAT tool, making it the standard practice, inhibit future change by monitoring key performances indicators, re-education where necessary, and observe outcome. Within this project, I have identified some educational needs for each group. To recognize and identify educational needs of the stakeholders, evaluate their significance to the success of the project, evaluate their eagerness of the project, and determine how to attract them. Ensure that stakeholders accept to participate in the project. Stakeholders will be made to understand benefits of using the SBAT tool efficiently. The plan for the project will be: after identifying the problem and assessing gaps in practice, a meeting will be arranged with the managers, the administrators, the quality improvement team, and the nurse educators to inform them about my proposed project and its benefits to the hospital and this patient group. During this meeting, a presentation will be done by me to discuss my intentions. Flyers on the use of the SBAT and a plastic card of the tool will be printed and distributed to the staff. Further down, questionnaires on staff perception on the use of the SBAT tool will be distributed to the nurse. I will visit the unit every 2 weeks for data feedback, motivation, and reinforcement. The entire project will take about 10 weeks. Data on pre-intervention and post-intervention will be interpreted and analyzed at the end of the project. Communication method that will be used for this project will be a face-to-face interview, Zoom meetings where necessary, emails, and if allowed, text messages. I have now come to the end of my education plan. Thank you for listening and see you next time.